Morning. Let us see about disaster management. So, a disaster is any occurrence that cause damage, ecological disruption, loss of human life, or deterioration of health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. So any damage which is going to cause all disruption, loss of human life, and deterioration of health and services, which actually needs helps from outside of the community. So people from outside, they have to come and they will be helping. So this kind of damage will be called as disaster. Then what is hazard? Hazard is defined as any phenomenon that has potential to cause disruption or damage to people and the environment. So we are having hospital waste. So we are doing hospital waste management. This hospital waste is actually a hazard. That is why we are doing proper treatment and management. So if we are not going to treat the hospital waste, it can lead to a disaster. It can cause an epidemic. Okay, that is why, in simple word, hazard can lead to a disaster. So here we are having some natural disasters: earthquakes, cyclones, floods, tidal waves, landslides, and volcanic eruption, tornadoes, fires, hurricanes, snowstorms, severe air pollution, heat waves, famines, epidemics or pandemic, then collapse of building, toxicological accidents, and nuclear accidents and warfare. So what are the effects of disaster? There will be injuries, then there will be death. Another things are emotional stress will be there among the people. Then there can be epidemics can occur. Why? There will be cross contamination of water or causes of any diseases of that particular area. They can get boosted up because of the vulnerability happens in that place. Why? People will not be having proper food. There will be malnutrition. Many deficiencies will be there. So immunologically, they will also go down. And any particular disease which any people are having the particular area can able to spread easily. So that is increasing indigenous disease. So these are the things will cause formation of any epidemics and damage to health facilities. So if there is a disaster like cyclone in that particular health facility, so there will be chance of damage to any health facility, then damage to water system also. That like flood, there will be cross contamination of water can occur, and food shortage will be there. Then population can move from disaster place to other place, and also from outside people can come inside for help. So this is disaster management. What are the aspects of management? The aspects are disaster response, disaster preparedness, and mitigation. Before going to that, this is disaster cycle. So here, disaster impact is there. It could be earthquake, or it could be cyclone, it could be volcano, whatever. So after disaster impact, there will be response, which is followed by rehabilitation, which is followed by reconstruction, then mitigation, then preparedness. So what happens? Here we can see one demarcation. So what it is? The whole thing is recovery phase after disaster. So disaster has happened. So what we will do when after disaster occurs? Then we are having mitigation and preparedness. This is risk reduction phase before a disaster. For example, like we will be knowing that at the month of this month there will be heavy rainfall. There might be chances of cyclone or chances of flood. So we will be doing things prior to that. So this is risk reduction before disaster, right? It is preventive aspect that we are going to do for the upcoming disaster. So disaster impact and response. So we have seen the three aspects. One is disaster response, preparedness and mitigation. Now we will start with disaster response. So what are the things? There will be a mass casualty. So what we have to do? We have to search and rescue the people. So mostly people from the same area, what they do, the people who are not, who is having mild injury or who can be the ambulatory people, they will start rescuing the people in the same place. So they will come up with first rescue. Then we have to do first aid, then triage and stabilization of victims, then hospital treatment and redistribution of patient to other hospitals. So these are the first response that we have to do. Then field care. We have to see for bed availability and surgical services should be maximized. And good food and shelter should be there. Then a center to respond to inquiries. So we have to have our inquiries for patients and relatives and friends. Then priority should be given to victim identification, and also mortuary space should be provided. Adequate mortuary space should be provided because there will be more mortality will be there. So if we are going to leave the dead bodies there, they will cause cross contamination of infection, which can lead to other communicable disease also. So triage. So this is important that usually in OPD, we will be treating the patient who is coming first. Then the next person will come. But here it is not like that. Here it is not on the basis of first come, first treated. But here we are giving priorities for different sets of people. How? Priority is granted to victims whose immediate or long-term prognosis could be good. So we have to assess the patient, and if we feel like this patient have to be treated, because why? Because if we treat now, if we are going to treat the severity people, their prognosis will be good in future. So those are the patients that we have to first treat to treat. Then moribund patients are having lowest priority. We are not going to treat moribund patient first because actually they will be in their almost end stage or they will be having the near death. So what we have to do, instead of wasting time on these people, if we are going to focus on this criteria, we can able to save more people. So why it is important? Triage should be carried out at the site of disaster. Why? In order to determine transportation, then we can do priority and treatment and everything, and admission to hospital, the treatment center, and patients, then prior to medical care will be reassessed. So prior should be kept on the disaster site. Here we are seeing that persons with minor or moderate injuries, that is those ambulatory patients, they have to be treated with their own homes. So they can able to take care of themselves. So here we are having the international color code for triage. We are having red, yellow, green, and black. Black is for dead or moribund people, and green is for ambulatory patients. That patients are any individual who is having minor injury or who can walk, who is stable. Then yellow is for medium priority, and red is for high priority. And these are the people who will be having severe morbidity. So if we are going to treat them or interviewing them, then we can able to save this large quantity of people. Here again they are giving tags. Here they are giving life threatening. And this is minor working individuals and dead individuals. And these are delayed, serious, not like the threatening. You can see red, green, yellow, and black. The next thing is tagging. Okay, all the patients should be identified with tags and stating their name, age, place of origin, triage, category, diagnosis, and initial treatment. So everything should be written and tagging should be done. Then this is very important point, identification of dead body. Because we have to stop cross contamination or further contamination of that disaster. Okay. Hello. Okay, there was some problem. There was some internet issue. Let us continue. So identification of dead, that is removal of dead from the disaster scene. Then shifting to the mortuary. Then identification of dead individual. Then reception of, just giving back to the relatives. Okay. Proper respect should be given to the dead bodies. Then relief phase. The type and quantity of humanitarian relief supplies are usually determined by two main factors. What are those? The type of disaster, the type and quantity of supplies available locally. So immediately following the disaster, most critical health supplies are those needed for treating casualties and preventing the spread of communicable disease. Following the initial emergency phase, needed supplies will be include food, blankets, clothing, shelter, sanitary engineering, equipment, and construction material. There are four principal components in managing the humanitarian supplies, that is acquisition of supplies. So what are those supplies that we have already seen here? Food, blankets, clothing, shelter, and all the sanitary engineering and construction materials. Then transportation. Transportation, that it could be any ambulance or it could be any transport that is going to give food in that particular site. That we have seen that in TV, we might have seen that in helicopter they are giving food supplies, all those things. Then storage is important because we have to store the food and materials that they are going to give. And distribution, that is again giving the people what they needed. Then something called disease control. This is very important because that disaster site itself is going to be very vulnerable. So we have to be careful to do disease control, or all the epidemiological activities should be done. So the principle of preventing and controlling communicable disease after disaster are implement as soon as possible all public health measures to reduce the risk of disease transmission. What are how the disease will be transmitted? Because of there will be overcrowding and there will be cross contamination of water and sanitation will be less. Why people are not going to take bath? Because there won't be proper water supply. And contamination, again, the already existing health programs, they cannot be run on the particular site because of the damage of health center, and also people are also in disaster site. Then there will be vector problems, like if there is any rainfall, or if there is going to be any vector any. One matter. So if there is any flood related things is going on, so what we are going to do, there will be problems of mosquitoes, and so which can lead to any malaria, any combination of malaria and dengue. So this kind of activities can happen. So we have to be very careful about that also. Then zoonosis, there could be chance of leptospirosis and food and water also should be taken care, right? The people who are going to cook food, they might also can cause infection, and water also, we should be able to provide water to them, both domestic and drinking purpose. So here we have list of increased risk of transmission of communicable disease, the provision of emergency food. It itself causes a source of infection, and ecological changes like breeding vectors and all those things we are seeing, contamination of water, then population displacement, introduction of communicable disease, like people who are going to come from outside, they can also cause then overcrowding, and when poor sanitation also can cause respiratory infection. And animals, if there is any animals nearby, they can also can cause all these problems. So first we are going to see about public health importance in control, then organize a reliable disease reporting system to identify outbreaks and to promptly initiate control measures. Then investigate all reports of disease outbreaks rapidly. Then comes vaccination, whether to give vaccination or not. In the case of disaster, whether we have to give vaccination or not. Actually, we'll be having pressure from political side, the public side, mass media side. So health, if suppose health authority is going to start mass vaccination program, what are the things will happen? One, it will be needing large number of workers when supervision of sterilization is impossible. Then this mass vaccination program leads to false sense of security about disease. So people will be thinking that they have been vaccinated, so nothing is going to happen. So that is one of the drawback. Then neglect of effective control measures. So main thing is that we have to provide more number of workers. That we have to give our manpower, but instead of doing it here, we can do it for other works. So whether to give vaccine or not, actually WHO recommend that you should not give vaccine. You should not introduce any new vaccine. Since there are multi-dose vaccine there will be multi-dose vaccine complaints. It will be generally poor in case of disasters. So we should not introduce new vaccines. About tetanus, there is no chance of significant cases of tetanus are noted. So generally, tetanus vaccination is not requested in disaster areas. But if some people might have been already taken that regular immunization, so those people can take tetanus. In nutrition, the immediate step for ensuring that the food relief program will be effective include assessing the food supplies after the disaster. So what amount of food will be needed, what quality of food that we should give, and whatever the food we are going to give, it should be less expensive. So we have to assess the food supplies after the disaster, then gauging the nutritional need of the affected population. So usually there will be vitamin A deficiency, protein energy malnutrition. So these are the vitamins and mineral supply will be very less. So we have to see to that these nutrition will be provided with the food. And then calculating daily food rations for the large population. Then we have to monitor the nutritional status of the affected population. Then rehabilitation. The final phase in a disaster leads to restoration of pre-disaster condition. So whatever the condition was there previously, so we are going to do that. So initially there will be more disease and more morbidities and more problem will be there. But when it comes to the rehabilitation phase, everything will come back to the normal thing. So in first week after disaster, the pattern of health needs will change rapidly, and moving from casualty treatment to totally normal primary health care. Then water supply, the main public safety aspect of water quality in microbial contamination. Fluorination is the best way of disinfecting water. So it is very cheap and very easy way of disinfection. So we are using fluorination. So there is something like single water supply and double water supply. In double water supply, we are going to give two supply of water. One is for domestic purpose and another for drinking water. But the problem is there will be contamination, cross contamination between these two itself. So it is not recommended. So we are living in a disaster site. We are already having some water sources in that particular area, and we are also providing some water to that area. So how to protect all this water? Because of there is chances of contamination, we have to protect it. So we have to do some restriction. So what are the things that we have to take care of? First is restrict access to people and animals. If possible, erect a fence and appoint a guard. Then ensure adequate excreta disposal at a safe distance from water source. This is also important. Then prohibit bathing, washing, and animal husbandry upstream of intake points in rivers and streams. Then upgrade wells to ensure that they are protected from contamination. If there is no sanitation well, then we are going to make it into sanitary well. And then estimate the maximum yield of well, and if necessary, ration the water supply. So adequate water should be needed. Then food safety. Personal hygiene should be monitored in individual involved in food preparation and kitchen sanitation. So what is the thing is, the people who are working in the kitchen itself, they can able to introduce new infection. So food safety should be there. Basic sanitation and personal hygiene. Emergency latrine should be made available to the displaced. Washing, cleaning, and bathing facilities should be provided to the displaced people. Vector control. So this is very important, especially in the case of flood-related places. Control programs of vector-borne disease should be intensified in the emergency and rehabilitation period in endemic areas. So mosquitoes can cause, these are some zoonotic diseases that they have given here. Dengue fever and malaria, the bats will cause leptospirosis and rat bite fever. Then lice and fleas will cause typhus, and this is fleas which is going to have plague. So these are the other zoonotic diseases also that we have to take care of. Then at last, we are having disaster mitigation in health sector. That disaster has happened, rehabilitation has done. Now we are in recovery phase. We are recovering ourselves. So to prevent hazard from causing emergency, to lessen the likely effects of emergencies. Medical casualties can be reduced drastically by improving the structural quality of houses, schools, and other public and private buildings. So we have to basically do the quality of houses, schools, and other public and private buildings should be improved. Then mitigation complements the disaster preparedness and disaster response activities. Now, disaster preparedness. The objective is to ensure that appropriate system, procedure, and resources are in place to provide prompt, effective assistance to disaster victims, thus facilitating relief measure and rehabilitation of services. So there is something like community preparedness. So we are going to take care of community members, then resources, organization, and administration should be the cornerstone for the emergency preparedness. Why community preparedness is needed? Because They are the members are going to lose, and they are going to be very vulnerable if any disaster is going to happen. Other thing is, they are the one who is going to come and help in case of any disaster. So they have to be trained properly, and their preparedness is much needed. Resources are most easily pooled at the community level, and every community possesses capabilities. And sustained development is best achieved by allowing emergency affected communities to design, manage, and implement internal and external assistance program. And what are the tasks to be done in the disaster preparedness? We had to evaluate the risk of the country or particular region. So we have to just see what are all the risks disaster can happen in the particular region. So according to that, we can do a disaster preparedness. Then we should have standard regulations and guidelines. Then there should be communication, proper communication, information, and warning system should be there. And there should be coordination and response mechanism should be there when there is a disaster site. Then we should adopt measures to ensure that financial and other resources are available for increased readiness and can be mobilized in disaster situation. So there should be proper financial economical support should be also done prior to any disaster. Then develop public education programs. So in case of disaster, we have to develop this public education programs, and also to save ourselves, they should be in a position to understand everything. And coordinate information sessions with news media, at last organize disaster simulation exercise, that test response mechanism. So we have to do drill, what we have to do when a disaster comes. So this is about management of disaster.